Dr. Stanley Goldfarb with Do No Harm is here, and Congressman Greg Murphy, who's also a medical doctor, joins us as well. Gentlemen, thank you very much for your time today.
Great to be with you.
Thank you very much. So, Congressman, I know your time is short, so I want to start with you right away. Give us a sense of what's going on with the medical industry and why you're concerned.
Well, Vince, Dr. Goldfarb and I have dedicated our entire lives to taking care of individuals, oftentimes of individuals that don't look like us. We're taught to take care of a patient regardless of what they look like, their ability to pay, their religion, their creed, or anything. But what's happening now is that the DEI theology of division is now infusing into medical schools in the admissions process, in the curriculum, and even in the hiring and firing and promoting of professors. It's an absolutely divisive and discriminatory theology, and we can't have that in medicine. This isn't, this isn't art school, I say. This isn't English school. This is medical school where lives are at stake.
Congressman, I've seen some studies and claims that in certain medical schools, what they're doing is they're lowering the MCAT requirements. That would be the entrance test for medical school. For people of certain races, and then raising it for people of others. What is this actually happening on a broad scale basis?
Yeah, well, we have a good graph. We actually showed it out at the press conference today that shows it is lower for the entrance in medical school for some different identities or politics, as you were, and then higher for other ones. The bottom line is that people, who do they want as their doctor? They want the smartest, the most capable, the most skillful surgeon. God forbid they're taking care of your child, your grandmother, your spouse. That's what people want. They don't want identity politics in medicine.
I'll get more into the data here with Dr. Stanley Goldfarb in just a moment, but Congressman, legislatively, what's the plan here? How do we address this?
Well, the Educate Act seeks to withdraw federal funding from any of these schools that are forcing this. They're professing DEI statements, the same thing as I said in the curriculum, as well as the accrediting institutions, which I think are one of the real problems also, going along with the AAMC, the American Association of Medical Colleges and Universities. This is coming from up above, pushing it down to medical schools. And this nonsense, this discriminatory behavior has to stop. And it has to stop now.
Yeah, federal money should not go to anything that advances racial, ethnic, or religious prejudice. I don't know why this even needs to be a law, but here we are.
We didn't want it 50 years ago. We don't want it now. So.
Yeah. All right, Congressman, thank you very much. Congressman Murphy, good to talk to you today, sir. Dr. Stanley Goldfarb, thank you as well for being here today. Tell us about your role in all of this and what made you so interested in the first place.
Oh, well, thank you, Vince. It's great to be with you. I've had a long career in academic medicine. I was the head of the curriculum at the University of Pennsylvania for 13 years. And it just became clear to me that medical education was starting to go off the rails. This sort of thing that the congressman has been such a leader in was the thing that bothered me the most, is that the best and the brightest weren't the ones who were being selected for medical school admission, but rather people were being admitted based on racial issues. I'm sorry if there's some extraneous noise, but I'm on the train, so I apologize.
That's okay. Well, we talk to busy people all the time. We're very accustomed to this. So Dr. Goldfarb, what are the risks if you are lowering the standards for who becomes a doctor?
Well, the example I've given, and I had a chance to say this several times today, is let's say you're in surgery and this person is standing over you, and he opens you up to correct a problem, and he finds something that's unexpected. And now he has to use all of his knowledge, his experience, his skill, his wisdom in order to respond to what he found, to make the appropriate changes, to deal with any complications that may occur. This requires lots of intellectual power. And frankly, that's reflected in academic achievement. So when you start taking in people with lower academic performance than others, you're risking the quality of that particular surgical outcome, for an example. So the risk here is better health outcomes, and risk is quality of care for the American people.
Give us a sense of some of the stories that have worried you. What are the things that you're seeing out there that go, man, we've got to stop this before it goes too far?
Well, some of the things that the congressman's bill will fight against has been loyalty oaths in medical school. Professors who want to get promoted or want to get hired have to claim that they're for diversity issues and even though if they believe that merit should be the deciding factor whether an individual should get a job or not. They have to claim things. So now they're being compelled to speak in a certain way that's inhibiting free thought. And once you start down that path, then you end up with the true sort of Soviet-style thinking here, with people being afraid to speak their mind. So this generally will cause a lowering of the intellectual level of medical schools. And then what we've seen is that the empirical literature shows that minority students as a group are performing less well in their residencies. Sorry about that noise. Performing less well in their residencies, and this has been shown in 2 very large studies. So
I think his signal may have been disrupted.
Readiness for practice.
Okay.
So you add that up, and what we're seeing is in the literature, not just my personal experience, but what in the medical literature shows is that these trainees that have gotten in based on DEI and affirmative action, really, before the Supreme Court decision, as a group are performing less well. That's not to say there aren't some brilliant individuals who are terrific, but as a group, there's a concern. And if you perform less well as a trainee, you're probably going to perform less well as a practicing physician.
Does this mean that also that better qualified candidates are not making it into medical school as a result, and thus the public is being deprived of future excellent health professionals?
You're absolutely right. There are 22,000 medical students, 44,000 people apply to medical school. And we know that candidates based on race and ethnicity are being moved ahead, pushed ahead, and others therefore aren't getting in because it's a zero-sum game. There are only so many spots, and there are people that don't get a chance. And we've encountered in my organization, Do No Harm, which is a watchdog group, a medical watchdog group. We've had many parents and students write in and tell us, they had extraordinary performance in college and couldn't get into medical school.
If you're a lefty, and obviously this is where it comes from, that ideology. If you're a lefty who's thinking to yourself that doctors in America are only old white men or something, have they been to a doctor's office lately? That my view, my sense is like that's one of the most diverse fields I've ever encountered, just in terms of shallow skin-based diversity. When I go see doctors and specialists, I see doctors of every gender and skin color all the time. What are they talking about?
Yeah, well, that's the other point is that I've said on many occasions there is no qualified minority individual who's attempted to go to medical school hasn't been given that opportunity. So the complaint about not sufficient numbers really reflects the fact that there aren't sufficient numbers of qualified candidates out there. That's the problem. So the solution has been to change the qualifications rather than to seek better candidates or to improve their previous education so they do qualify.
Is it hyperbole to say that people will die as a result of all of this?
Well, that is obviously a strong statement, and you always hesitate to make too strong statements, but that's certainly a concern. I will say that for sure.
Yeah, and one of the reasons I ask is it formed the centerpiece of a conversation between Elon Musk and a former CNN host by the name of Don Lemon this week. They were talking about this very thing, and Elon was trying to impress upon Don Lemon that this is going to get people killed. And Don kept saying, well, this is hypothetical, it's not happening. He even claimed that evidence shows that that if you have more minority doctors, in other words, if you lower the standards to allow minority doctors into medical school and to come out as doctors, then that's better for the medical industry.
Right.
What do you make of that?
Well, we've addressed that. 2 of my colleagues, Ian Kingsbury and Jay Green, did a very extensive evaluation of the medical literature on this question, and there is quite a robust medical literature. And they found 5 systematic reviews, which encompassed over 60 studies that were studied in various combinations in these reviews. And what they find, which we published on our website, donoharmmedicine.org, is that there's absolutely no evidence. There's absolutely no evidence that having a black doctor improves the health care outcomes of black patients. None whatsoever. People cherry pick one study, but there are an equal number of studies that show, if anything, that the interactions can be worse between people of the same race. So the issue is to get the best doctor possible. And, it's demeaning to black patients to think that they're interested in having a physician of their race as opposed to the best physician available. They want to get better. They want to get the best care. They're not foolish. And to assume that they are and that they're so racialized that's an important fact.
Yeah. Uh-oh. I know he's on a train, so that's one of the issues here. So, Dr. Goldfarb, it sounds like you may be reconnected with us. I just want to thank you so much for spending some time with us today in advance and doing the research on all this. It means so much.
Well, Vince, you're terrific, and we really appreciate you very much. So thanks very much for having us.
Thank you very much. You had a busy day today.